Good afternoon and thank you for joining us. My name is Tina Tebow and I'm the Director of Media Relations for the province of Nova Scotia. I will be your moderator for this afternoon's news conference. Joining us today, the Honourable Stephen McNeil, Premier of the province of Nova Scotia, Dr. Robert Strang, Chief Medical Officer of Health for Nova Scotia. Go ahead, Premier.
Thank you, Tina. First, Dr. Strang will give us an update on where we are with COVID-19 cases today.
Thank you, Premier. Good afternoon, everybody. Today we're announcing 17 new cases of COVID-19, bringing the total number of confirmed cases in Nova Scotia to 68. Like the others, these cases are travel-related and connected to earlier reported cases. We know that several of the new cases are connected to groups or families who had returned to Nova Scotia following travel outside of Canada. None of the cases are from spread within the community. Of the 68 individuals, they range from under 10 to the mid-70s. Two of the individuals have now, we can report that they're fully recovered from COVID-19 and they're now considered resolved. One of our cases remains in hospital. To date, 2,772 Nova Scotians have been tested with negative results, and then of course we have the 68 positive results. I think it's important to understand that we actually anticipated this. We knew that we would have large numbers of people traveling and that would be coming back this week. So this, I see this as actually, while we're concerned about the cases, it also, to me, it's an indication of what we put in place is actually working. That we knew people would be traveling, potentially exposed. We set up systems to require isolation immediately upon return, that we set up systems through people could get telephone advice online and then telephone advice for 811 and then get directed to testing centers promptly with appropriate infection control. And then we would manage those people with public health follow-up and identifying close contacts. All of that is working. The fact that we are, and I want to thank Nova Scotians who are adhering to the requirements around self-isolation. So on average, we're seeing just a little under two, for each case, a little under 2 close contacts for each case. That tells us that people are adhering. We know this from our follow-up. People are adhering to the self-isolation, and many of the contacts that they're having are within their household. So what we're doing is working to, and it's minimizing the potential for the spread of COVID out in our communities. So I want people to understand that we anticipate the numbers and we put things in place, not naive that we are going to continue to see new cases and we may well see some community spread, but everything we're doing is built around controlling that spread as much as possible, minimizing the impact in Nova Scotia. We're in a position where we're further behind by two to 3 weeks in some of the other larger provinces, and that the things we are putting in place is actually at a time when they can make even more of a difference by minimizing community spread. BC, Ontario, Alberta are challenged because they're putting in the strict measures when they're further ahead in their epidemic, and it's much more difficult to get a handle on things. So my main message is that we are at a place that if we all do work together and apply our personal protective measures, our social distancing measures, all the closures that we put in place, if we stick with it for the next few weeks, we have the opportunity to really get out in front and stay out in front of this and minimize the spread and the impact in Nova Scotia. It's critically important that we keep doing what we're doing. We have good systems in place, but it depends on all of us to do that. We all want to, just quickly, we all want to stick with our social distancing, which is really the key message is stay at home as much as you can, avoid close contact with others. If you do want to go out, have one person go shopping for essential needs. If you're just social distancing and you want to go out in your community, by all means, go for a walk, go for a bike ride, but respect that social distancing and don't get together in groups more than 5. For those who have been told because of travel or contact with a case that they have to self-isolate, it's stricter. But if you can, if you're fortunate to have a yard or a balcony, you can go out within your home environment. But I also recognize that lots of Nova Scotians don't have that luxury. But we really ask that it's important that you stick with that. If you're self-isolation, you really tightly need to stick within your home. And people who are in multi-unit dwellings, again, I recognize how much of a challenge that is. But we ask you to be creative, and we ask your neighbors, your people who live around you, to support you and not be criticizing each other and viewing each other in a negative way, but find out, how do we help people who need to self-isolate? How can we help them maintain that self-isolation? We can all do by working together, and I'll say it again, in a sense of caring for each other, in building a sense of community, and by using some common sense. And if we all stick with it, we can make a huge difference here. This is really challenging times. The Premier and I are fully aware of the imposition and the challenges of what we put in place and what it is requiring people to do. And there's also, this is a fearful time. This is a situation that virtually all of us, we've never faced something like this before. It's okay, it's understandable, it's actually natural that we feel afraid about this. But we need to recognize that, and then how do we, there's several things we can do with that fear. First of all is gaining a sense of control. The things we're asking people to do, social distancing, hand washing, personal protection, that allows you to get some sense of control, that you can do these steps, you're doing them, you're protecting yourselves and others. So we know that from psychological research that having a sense of control is a way to help manage that fear. There are other ways that we need to, don't be afraid to talk to each other about it. Be open about how you're feeling. Reach out for help. We have lots of, in today's, with phones and virtual means, we have lots of ways we can connect with each other. It's important that we continue to do that and support each other. I just want to end up by saying, just to point out that we do have a couple of resources if people are feeling really challenged. We are working to get more information on kind of psychosocial supports on our coronavirus website. There's also the mental health crisis line, 1-888-429-8167, and the kids help phone, 1-800-668-6868. And I'll end by saying we have the opportunity by working together to make a big difference. So let's look after each other. Don't be afraid to reach out for help. And if somebody reaches out for you for help, give them a helping hand.
That's a great message, Dr. Strang. No one should feel like they're in this alone. There's been many changes in our province. Make sure that if you're isolated, that you reach out to someone, talk to them, and vice versa. If you know someone's been isolated, reach out and talk to them. Not only have there been many changes in our personal lives, but there's been many changes in our professional lives and our workplaces across our province. And I'm sure many of you have questions of what that means to you. But most importantly, as Dr. Strang has said, we're thinking about the health and safety of Nova Scotians. Employers and workers must follow the orders issued under the Health Protection Act. Yesterday, I talked to you a bit about the categories of essential service: health, public services, including police and fire, IT, telecommunications, critical infrastructure, food, agri-food, fisheries, transportation, construction and manufacturing. These essential services are exempt from the 5-person social gathering rule. Work is not social gathering. On construction sites, for example, if soap and water isn't available, hand sanitizer must be made available. Workers should self-distance. Some call centers are still up and running. They are essential, and they've changed the way they work. For now, we will continue to allow our essential services to work. We are just asking you to work differently. For those of you who have specific questions or need advice around workplace health and safety or labor standards, you are encouraged to reach out to the Department of Labor's Safety Branch, and those numbers are available on the government's COVID-19 website. And I encourage you to take advantage of those if you have any questions specific to your job site or workplace. And with that, we'll take some questions.
Again, we'll take questions from the phone line. We'll take one question and one follow-up. We'll start with Jesse Thomas from Global. Go ahead, Jesse.
Thanks. This is just regarding community spread, I guess. We've been asking about that for several days, and we've just been getting calls here in the newsrooms of people with symptoms, and, they've got the fears that you guys were talking about. And it's maybe been a dozen people just calling global alone, but in the community, I'm wondering how many tests now that we've ramped up to 400 have been administered for specifically community spread tests, not travel-related testing.
So our testing is mainly still focused on travel-related, but as I said yesterday, we've already started testing contacts of close cases, and those are some of the results that we're reporting today. We're getting those results in. Anybody who requires a hospital care where it's clinically appropriate, so they have the appropriate symptoms, we are testing for COVID-19. We haven't had any of those come in that way. We're also looking for indicators of clusters of respiratory illness. So as I outlined yesterday, we get daily reports on the percentage of people coming into emergency room with flu-like symptoms. We're looking for outbreaks. We've had a recent outbreak in a long-term care facility of some other respiratory virus, but we made sure that we were testing for COVID-19 in that circumstance, and we'll continue to do that. We're also looking very quickly to how we move into other, use our assessment centers to perhaps start to look at how we test other groups of individuals that may not have traveled but have symptoms. We have to remember two things: that we still have influenza. We're still in influenza season. That's not over yet. So lots of people who haven't traveled, who have flu-like symptoms, there's a good chance they have influenza, not COVID. We also have to make sure that we work within our lab capacity. We're working to rapidly expand the lab capacity, but we also can't overwhelm it by having everybody coming in to be tested. So we absolutely know, and we're actively working on expanding into community testing. And if we do get indications of actual community spread, which would mean that we have a case that doesn't have a link to anybody that's related to travel. If we start to see that, we will certainly be bringing that forward and include that as part of our regular updates.
Jesse, do you have a follow-up question?
Thank you, Dr. Strang. I guess this virus, I know it doesn't know borders per se, but we've kind of got this interprovincial border crossing set up, and people who cross it have to self-isolate. I guess my question is, will a traveler, say, from New Brunswick who crossed the border, would that be considered community spread? And just clarification, have we tested anyone for community spread, or is that zero tests right now?
So we don't test people for community spread. We test them to see based on symptoms. As we do our public health follow-up, we get details on where they have traveled or not. And as I said, all the cases so far are based on they have had a history of travel outside of Nova Scotia, and the vast majority is travel outside of the country, or they have been exposed to somebody who has traveled in a household setting generally. So all our cases, as I said, can be at this point in time linked directly to some travel outside of Nova Scotia. If we start to identify through our follow-up of cases people where we can't make that link, that is the indication of community spread. We haven't seen that yet, but we're rapidly expanding our testing so we can test more Nova Scotians who haven't traveled. We're probably going to see some of that. We're open and transparent, and we will be talking about that if and when it happens. But everything we're doing is by rapidly identifying cases, testing their contacts, also will minimize the chance of, even if there is somebody in the community that we don't know where they've got it, we can rapidly, jump on that case and test all their contacts and put them in strict isolation and then get their results. So through public health follow-up, we're well aware of the need to move quickly on known cases and isolate people and test them, and that in itself will be helping to prevent any further spread in communities.
Thanks, Jesse. Next, we'll go to John McPhee from the Chronicle Herald. Go ahead, John.
Hi, this is for Dr. Strang. We're seeing the emergency response system tighten controls on who can attend who can attend medical calls, such as volunteer firefighters, because of COVID concerns. Does this raise additional concerns about rapid community response to medical emergencies, that lives will be endangered because of delays in getting to people?
So I've heard those reports. I haven't been involved in any conversations like that, but I have full confidence that my colleagues in first response emergency responders, a combination between police, fire, ambulance, are working through this together to make sure that Nova Scotians who need prompt medical attention are going to get that medical attention. We have a world-class paramedic service in Nova Scotia that is stood up and is fully part of our health system response, and they do work in close collaboration with police and fire.
Do you have a follow-up, John?
Yes, thanks. One of my colleagues is writing about a man who apparently returned from travel on February 21st, but he didn't start showing COVID symptoms until March 12th. Is this kind of delay in acquiring the virus and showing symptoms unusual?
So February 21st, and then what was the date in March?
March 12th.
Yeah, so that's more than 14 days, and so that's really outside. If somebody, as I said, we're still in influenza season. I don't know the details of the case, but somebody who gets sick with flu-like symptoms, which is how you present with COVID, beyond the 14 days of possible exposure, would have some other respiratory virus.
Thanks. Next, we'll go to Shayna Luck from CBC. Go ahead, Shayna.
Hello. I'm wondering, Dr. Strang, you talked about last week the status of homeless or vulnerable population working group and their efforts to create a response plan. I'm wondering what details you can release about that response plan, and when will we have more?
I don't have any details that come to me. I know the deputy ministers leading that work are working rapidly with the organizations like Shelter Nova Scotia. We'll take that back and have some conversations about potentially bringing that forward.
And a number of the departments have been working with Mayor Savage here in HRM and his team to help support that vulnerable population.
Do you have a follow-up question, Shayna?
Yes, I do. I'm wondering, and this is for both Dr. Strang and the Premier, how are we doing in terms of getting health workers access to supplies like masks and hand sanitizer and ventilators? And as well, what are our options in terms of turning to supplies like distillery-made hand sanitizer? Can we do that?
So we're well aware of that. So as we outlined yesterday, we're participating in a national bulk procurement process. So through the Department of Health and Wellness, we are working with a number of partners in the healthcare sector, our health authorities, family doctors' offices. We're working, even though dentist offices are closed except for emergency. They're all identifying what their needs might be. We put that into a common process of what we need in the health system. That goes into the national procurement piece that is underway. We have left over from H1N1. Actually, we did have a stockpile here in Nova Scotia, so we're using that to supplement our existing current supplies. We're also getting lots of people reaching out to government industries saying we have certain amounts of materials and how do we connect with you? So, and we're also reaching out for across the school systems and other who have identified that they have supplies of personal protective equipment. So there is a coordinated approach to reach out in the federal process, to reach out across government, as well as to coordinate any of the businesses that are coming into government saying we have something to offer.
So it's been working with inside of government, as Dr. Strang just said. For example, in education, N95 masks, we've been able to identify a number of them there. Private sector entities have reached out as well with some of their equipment. We've looked beyond our own borders, not just dealing with the procurement process with the national government. We're using our own networks that we typically would order through, and other contacts around the globe to identify whether or not they have excess equipment there. And the national government is putting together a Made in Canada program that would allow companies to retrofit themselves to build ventilators here or equipment. We've identified a couple of Nova Scotia companies that can do ventilators and a number that can also manufacture garments. They're in that process, and we're hopeful that not only will Canada have a process to build our equipment, but that Nova Scotia companies will be a big part of that.
Next, we'll go to Natasha Pace from CTV. Go ahead, Natasha.
Hi there. The first one will be for Dr. Strang. We're just looking to confirm, I guess, in total, how many people have been hospitalized, are still in hospital right now, and if there is anyone in the ICU.
So we've had 2 individuals hospitalized, and one person remains in hospital. I haven't been able to check on their current status where they were, and we're also very careful about disclosing, clinical information of an individual. But we have had 2 in hospital, 1 remains in hospital.
Do you have a follow-up, Natasha?
I do, yes. It would be for the Premier. In terms of enforcement, Quebec and also Newfoundland have now started arresting people who aren't complying with public health orders. There's still lots of people out and about. I'm wondering if police need to be doing more. Do you feel like we need to step up enforcement, or perhaps the consequences for people not obeying, or are you happy with how things are right now?
Well, police I know have been out around social gatherings, even on job sites, work sites, identifying individuals, whether or not they are following the process. If they're not, they communicate that to them. They've had good response from citizens to break up the social gathering component. But at some point, if this continues, we're heading into a weekend, for example, if this continues, I'm sure law enforcement recognizes they have the ability and the tools to be able to start fining. But at this point, they're working with them. I would also tell you that, there is that people are out and about. When you're asked to self-isolate at home, you can be out around your neighborhood, you can be out walking in that neighborhood. People who have gone away and are coming back and are doing things in their community, but then they're heading home. Like my family would be like many families across the province where, someone's been identified to go to the grocery store and that person would be in and out. So as long as people are practicing the protocols that Dr. Strang has put in place, the 6 feet distancing, no social gathering, do the proper hygiene, we'll continue to be able to allow some activity to happen within inside of our province, to allow the economy to move, to allow people to get the essential services they need at the same time as we control this virus.
Next, we'll go to Keith Doucette from the Canadian Press. Go ahead, Keith.
Good afternoon. Question for the Premier. I'm sure, as you know, the federal government has put in place quarantine restrictions as of midnight on our borders. You took a somewhat similar step on Sunday. You said that some smoothing out needed to be done. Can you give us an update of how it's actually working in the Amherst-Sackville area right now?
Yeah, it's going well. My understanding, I was briefed on it this morning, actually. We have an essential service lane, a 3rd lane now, that is allowing trucks to be able to move through. Healthcare people are moving through uninterrupted, very positive that way. We have seen a reduction in traffic. I think people are getting the message. If you're not coming here, if you're not coming back home, if you're coming here to socialize, stay home. And if you're coming here back home, you need to self-isolate for 14 days. So the border work at the borders is going well, and my understanding, the same thing at our ferries, the one in Digby and the one in North Sydney.
Do you have a follow-up question, Keith?
Yes, it's for Dr. Strang. In terms of the numbers, do we have any breakdown of where the people who were confirmed cases had traveled to? Specifically, we're wondering about the number of people who were in the United States.
I don't have that specific breakdown. I do know that certainly a number of cases were in the United States, but we haven't broken that down with specific numbers. I'm not sure that's really that important. We know that there is COVID-19 around the globe, and travel anywhere puts people at risk, and even the act of traveling and going through airports and on airplanes with travelers from around the world puts you at risk. So the main thing is that no matter where people have traveled, once they get home, they have to isolate very strictly.
Next, we'll go to Cassandra Nadeau-Lamarche, Radio-Canada.
So this is for Premier McNeil. So some grocery stores and grocery stores chains are stepping up to pay their workers more under these circumstances. Is any consideration being given to maybe doing the same for healthcare workers or essential services in the province?
We're looking at really ensuring that we keep our population healthy that is working the essential service component, and then looking at how do we support those Nova Scotians who have actually lost their jobs with no paycheck. There are families out here today where both working parents have lost their income. We're looking at how do we best support them as we do this, and then those that are working the essential service side, we will do all we can and continue to work with them to make sure that we maintain a safe workplace, that they get the equipment that they required, so that we can all get back to a level of normal life here in Nova Scotia.
Cassandra, do you have a follow-up question?
Yeah, so Premier, on Monday you said that if people have to drive to get their exercise done, they are going too far. We have heard reports of people being stopped by the police on their walks and being told that they were too far from their home, even though they did not drive there. So what are the guidelines exactly, and maybe are some police forces getting the wrong information?
Not heard of that situation, but the length of walk, all of us would be different lengths, I guess. But if you're leaving your house and walking in your neighborhood, that's what we're looking for. What we don't want is to have people get in their car and drive to their favorite park, because the problem with that is we can't control how many of us go there. We do know how many people live in a particular neighborhood. You can walk around that neighborhood. You wouldn't be congested. They wouldn't have the social gathering that you would get in parking lots across the province. Last weekend, we were having traffic jams on some of our major beaches and in some of our parks. That is just unacceptable. That is behavior that will cause this virus to have community spread. That's that simple. What we're asking people is to use common sense, walk around their neighborhoods. Yes, some are going to walk further than others. I believe we're asking everyone to practice the common sense, and that would include law enforcement when it comes to people out walking. But we've not heard any situation like that. But we've not put a restriction on the length of your walk. But it's just, please do it in the community that you live in.
Next, we'll go to Lindsay Armstrong from All Nova Scotia. Go ahead, Lindsay.
Hi there. Yes, this is a question for the Premier. Is the province considering some form of financial aid for municipalities who are facing deferred property tax revenue in the coming months?
We're working with our municipal partners, and I appreciate the question. It gives me a chance to say thank you to municipal and community leaders across the province who have been very cooperative with Minister Porter and his department. And with my office. This is putting pressure, obviously, on municipalities as well. But we'll work with them to find out what is the appropriate package for them. But we also have the issue of how do we deal with these small businesses that we've shut down. We also want to make sure that we can keep them somewhat viable, so that when we find our way through this challenge, that we'll be able to start those businesses up pretty quickly to get the economic part of our economy moving forward.
Lindsay, go ahead if you have a follow-up.
Yes, this is for Dr. Strang. I know that you mentioned that we've expected these cases to rise at the rates they're rising at. How long before we expect to hit 100 cases?
I'm not going to speculate on the rate of rise and when we get to a specific number. I'm focused on, I know, being realistic. We can fully expect to see more cases. Our hope is that as we actually get Many of the people traveled back into Nova Scotia from March break with a 14-day incubation period. This week and next week, we expect to see lots of cases and travelers. If we're really good at everything we're talking about, and by good, we is all of us doing it together, once we get beyond that 14 days with the surge of people coming back from March break, if we're controlling the spread, what we hope to see is then a tail off of that, and the increase at least be minimal or plateauing if we're really good at this. But all that will depend on how effective we are collectively applying all the measures we've been talking about.
Next, we'll go to Paula from CHNE TV in Shettycamp. Go ahead, Paula.
Thank you. This is a question for the Premier. Could you give me any updates from your ongoing conversations with the federal government about assistance for seasonal workers? So not people who are in quarantine now, but who depend on the tourism and the fishing season opening.
Well, part of the national package that went through the Senate today, we're looking at, finalized through the Senate today, we're looking at what that means for seasonal workers in our province. We have, the federal government has said that no worker will be left behind. We will agree with them and do everything we can to see how this program would work. I think today the Prime Minister announced a program that would be funding directly into families whose livelihood has been impacted by COVID-19. So that would include those seasonal workers.
Do you have a follow-up, Paula?
Yes. So last week, the Department of Fisheries and Aquaculture announced collaboration with the other Atlantic provinces. Could you tell me what that will look like in terms of fisheries?
Well, there's been ongoing talk with our Department of Fisheries, Ministers of Fisheries. I spoke to Premier King today briefly through text. We're going to have a get-together with our arranged call with our other Atlantic premiers, specifically about the fishing industry. What does that look like? Right now, we're out on the water. People are on the water. Some of our fish plants are still functioning. We're processing product that's coming in. Our big worry is really price. When it comes particularly to lobster. We need to make sure, we need to have obviously a market, which will impact that price. So we're very concerned, what that would mean to the economic future of Atlantic Canada. I don't have to tell too many people what the lobster and live fishery means to so many rural communities. And we're working very hard to keep that food supply chain moving forward, and we'll work with our partners in the Atlantic region to continue to reassure lobster fishermen and other fishermen that we will be out in the marketplace looking for them to get the appropriate price so that they can continue building and growing their business, but more importantly, employing some Nova Scotians and growing the economy of those regions.
Thanks, Paula. Next, we'll go to Tim Bousquet from the Halifax Examiner. Go ahead, Tim.
Good afternoon. I have a question for the Premier. Sunday, you declared a state of emergency. Under the terms of the Emergency Management Act, it's no longer allowed for people to raise prices for a wide range of goods, including food. But I'm hearing from many people that prices are going up in the grocery stores and elsewhere on essential products. And you haven't said a word yet about price gouging since you declared the state of emergency. People were facing April 1st rent payments, and people are very concerned about rent. So I'm wondering if you could address all of that.
First of all, I've not heard of any situation of price gouging. That has not been something that has been brought to our attention at all. As a matter of fact, retailers across the province and grocery stores have been beyond belief when it's come to ensuring that they provide safety for their own workers, but ensuring that Nova Scotians get access to the essential products that we require. Whether or not those prices have changed somewhat in the past 10 days, we have not heard that. I've actually heard the opposite, quite frankly, is that stores have been very supportive of working with individual families and communities. And we will continue to monitor that and watch it. And I would encourage anyone who feels that that is happening to reach in. They can reach into my office, and we'll do the inquiring for them. In terms of the rent, you're very right. It's coming upon us very quickly. There are those whose income has been impacted by COVID-19. We need their landlords to work with them to ensure that they can help that family through. I think the first unemployment check is April 6th. So landlords need to be supportive and flexible of their tenants. At the same time, those of us who can afford to pay, who've not been impacted by COVID-19, who still have income, need to make sure that we pay our rent on time. These large commercial agreements with banks still have to be paid. We're hoping that we can see something from the big six banks working with the national government when it comes to commercial lending, not only on the residential side, but on the commercial side. I've said this many times. We need those commercial loans to be deferred, and we need the landlords of those deferred payments to pass that on to the renters. And that way, what will happen is the restaurants, the small businesses will be able to weather this storm by deferring their rent payments, leaving some cash in their company, leaving some cash in their pockets for their families. And it will also allow us then, when we come out of this, to turn our economy back on in a hurry. If we don't get that deferral, if they don't get that deferral, we're going to see a number of these businesses go under, which means it will be more challenging for us to turn our economy back on in a hurry, and we will feel the pain economically coming out of this a lot longer. But the collaboration between landlords and renters will require everyone on both sides, both the landlord and the renter, to come together in cooperation and work together to ensure that that building stays viable and that families aren't being forced out or having to choose between doing rent or buying groceries.
Do you have a follow-up, Tim?
As we're all through the live tonight.
I do, and someone's talking over me. I'm sorry.
Go ahead, Tim.
Yes, on the residential.
All right, we're going to shut the line down. There's too many people asking the question. Tim, we'll come back to you tomorrow. Sorry about that. Premier, go ahead.
Thank you, Tina. Our numbers are growing, and it is a worry. Part of it is people are returning from March break and the snowbirds are coming home. But we are among the lucky provinces where community spread has not happened. But let's not kid ourselves. It could just about any time. But we have the ability, each of us, to control it. That's why we cannot become complacent. We must continue to follow the good doctor's advice. Wash your hands frequently. Stay home for 14 days if you've traveled outside of Nova Scotia. Keep your distance 6 feet or 2 meters from others. And I know it's not easy. It's lonely. And I worry about the isolation and what it does to a person. That's why, Dr. Strang, I was so pleased to hear you talk today about encouraging Nova Scotians to monitor their mental health. Reach out to the right channels if you need help. Pick up the phone, call a friend, or check in on one another. FaceTime has become a lifeline. You may not be able to do a visit in person, but a virtual visit can be just as fun. Social media that sometimes focuses on negative seems to have found a more positive place in our world. So many community groups have popped up, known now as caremongering groups, people coming together to share, to support each other, and to spread kindness and love. Let's focus on that from inside our houses, not outside.